We're talking to you about ribs today. Not a good topic when you're bony, but it's summertime, it's sport time, it's outdoor adventures, and broken ribs. Usually with falls, sorry, don't mind his head. With falls, with contact sports, with actually you can have a broken rib or a contused rib even with baseball by catching a foul, getting hit by a foul, falling on a diving board, falling off a skateboard. Whatever it is, you can get hit to these things. There's 12 of them on each side. They're called bucket handle because I took his arm off. It's an Aikido move, but I took his arm off. Each rib connects to the front at the sternum and to the back at the backbone. Those two connections will allow two spots to stay solid, then you kind of just articulate the ribs up and down. When you breathe in, the ribs move up, diaphragm moves down, and you fill the lungs up. When you breathe out, diaphragm moves in, the ribs compress, and then you squeeze all the air out of the lung tissue. So that's basically what happens with breathing in and out. If you want to do any breathing exercises, I'll put a link to my breath exercise and also help you if you are suffering from a bruise. There are some exercises you can do to increase volume, but I'll save that for later. The idea when you have any kind of contusion or bruise or any kind of trauma is you have to make sure it's not broken. The only reason you have to make sure it's not broken is because if you have a bruise to the rib from either taking a hit, taking a foul tip, or falling on a solid object, then this is a bone like any other bone, and it will have an accumulation of blood. If you were to get hit on the outside of the arm, just from protection, from a foul tip, or from falling, you have a big bruise and it would hurt every time you move the arm. I would put somebody, as long as they weren't fractured, in a sling, big deal. Usually about 10 days everything's better with anti-inflammatories, turmeric, magnesium, and maybe topicals. Now in a rib, you can't tape. Well, we used to be able to tape people or towel clip people. You'd get a big towel, wrap it around, clip it tight so they wouldn't move, and that would save them from the inhale and exhale pain of a broken rib. But unfortunately, it was found that after a couple weeks, people that towel clipped themselves developed pneumonia because they weren't moving the lung on the inside. So nobody does that anymore. We usually will just, if I'm in the field, and I've done this on a couple of hikes and vacations, if I have somebody who feels like they're tender to one spot, they were hit by a jet ski or some other contact sport, and they were okay, their breath was all right, they weren't suffering, it wasn't too bad as far as pain, I let them go. You can actually go to emergency room if you want. They can get a $200 to $300 set of x-rays. You can see a physician for another $200 to $400, and then you can be given pain medicines and anti-inflammatories and told to follow by the doctor. I could save the money. Now, I'm saying that in a cavalier kind of way, but most ribs are covered by a coating or a wrap. The wrap will usually keep the ends of the ribs together. If it's severe trauma, then sometimes you can actually break in two places. Break here, and every time you take a deep breath in or out, you'll have this flail piece coming out and coming in opposite to your breath, and it won't help the breath and it'll hurt terribly. Sometimes you'll have air coming through into the skin and you'll have these crunchy rice kind of crepitation or feel. That's not healthy either because the air will spread into the rest of the upper chest, lower chest. It's not good. It can also spread and collapse the lungs. So those scenarios aren't good. But it's very rare that you'll have in the usual standard sports activity outdoors, it's very rare that you'll have two broken pieces. It's very rare that you'll have a flail chest, it's called. It's usually more typical to have one break, one spot, and it'll be in the wrapping and it'll stay together so that it heals up in about 2 to 4 weeks. At the most, if you're older, 12 weeks. But it depends again on if you're a smoker, if you have good health, if your diabetes is under control, if you are stretching and pliable beforehand. It also depends on what you do. If you're a construction worker, then that's a problem and you're going to have a persistent pain. So either way, the bottom line is if it's a small crack, you should be able to get by with pain control, inflammation control, and then gentle mobility. And that's the funny part because usually you would think you don't want to move a broken rib, but because the muscles, the intercostal muscles that sit between these ribs, they're supposed to stretch and pull, that's their job. until you're 80 years of age, or until you get emphysema from smoking too much, but they're supposed to do that for a long time. When they stay tiny because you're holding like this and you don't want to breathe because it hurts, well, number one, pneumonia's coming, but number two, those muscles get really shortened. If you've ever stopped running for a short amount of time or had an injury, you usually have to isolate the extremity that's injured, and you'll notice after a couple weeks the extremity has tinier muscle, tight joints, and it's hard to move. Same thing with this. Pain can actually start from all those muscles getting tight. So that's why sometimes after you get diagnosed, it's wise to get mobility going. You can actually have some people do transverse friction to the superficial muscles to stretch them. Some people will help with flexibility and stretching, not necessarily bounding, but sometimes some of the yoga breath exercises will help to stretch out and get you to tolerate the discomfort. You're not going to want to do that the day of your injury, but as time goes on, it'll be nice to introduce a little bit of movement. Not only will it be good for the area, stretching the muscle, you'll also bring more blood into the area to help with healing. If you're taking anti-inflammatories, you'll have more anti-inflammatories in the blood get to the area that needs to be helped. In addition, if you have extra vitamin D, if you have other turmerics that you're taking or magnesium that you want to take, it just helps to get more blood flow in the area. It also helps with the lung. Lung gets to expand, you get to avoid pneumonia or bronchitis or that extra pleural effusion or that extra fluid that develops. Altogether, it's just healthier for you. I've had some people with acupuncture have good results with putting needles into both sides. It's a meridia. Acupuncture is this study. I'll put a link to one of my acupuncturists that's doing acupuncture on a patient in my office. But you'll see it's an ancient technique that helps healing different than Western medicine. But bottom line, to make it short for the video, you can do acupuncture needles, help with relaxation, help with getting mobility going to the muscles so that you can, again, start breathing. That'll, I think, improve your healing and speed up healing time. You always want to be protecting, if you have an injury, protecting from further damage. Do no further harm. So if you have contact sports, if you're doing a lot of lifting, if there's going to be anything that brings harm, then you have to take that time away from that activity. You have to allow for a little bit of healing, a little bit of callus formation. If there is going to be an x-ray, fine. If an x-ray is done, usually what we'll do in the office or in the hospital is do multiple x-rays of the ribs. You can see these things in 3D, they go in a curve. Usually x-rays are one way and in another way. So with the curve, you have to get a couple different spots. That's why it's called a series. You have to get a couple different spots and recreate this 3D image for the radiologist or the guy that's reading the x-ray. Sometimes the smallest tiny fractures will not show up on a first set of x-rays. So if there's persistent pain into the second week, that's probably more than a bruise. I think for the most part, a bruise, just like I was saying to the skin, takes about 10 days before you see the black and blue go away. It'll turn purple, green, yellow, and then go. The same thing will happen to the accumulation of blood to the top of this area that was hit. You'll have a bunch of blood there. You'll have it tender because it's swollen. But it will go away in about two weeks, 10 days to 14 days. If anything persists, then it would be nice to have an x-ray just to give yourself a schedule of, well, exactly how long it's going to take to get better. And sometimes it's important to make sure you don't have a pneumothorax or introduction of air into the lung. If you're an asthmatic or if you have COPD because of chronic smoking, a big hit to the side can collapse a lung. It's very rare, but it can happen. Coughing can also do it. I've seen people with osteoporosis actually cough and break ribs. I remember a nun that I used to take care of, a great lady, but she had asthma and she was always needing steroids in the wintertime, at least twice a winter for the 10 years that I saw her. Eventually the steroids helped in controlling the asthma, but it gave her osteoporosis, so in her last years she would break ribs just with coughing, sneezing, laughing. It was a bad way to go. So it is important for you to get osteoporosis scans to prevent that, or at least know where you stand. So again, with this rib, sometimes in the worst case, if you have chronic pain, can't take it anymore, can't breathe, don't want to take narcotics, the nerves that come around and supply sensation for the rib all the way to the front, the nerves back here can be blocked by a chronic pain specialist. They'll actually destroy the nerve as it comes out of the spinal column, and you won't have the nerve anymore because it'll be destroyed, but you also won't have any pain. The worst case scenario is you'll have numbness to this area for the rest of your life, but some people who have chronic pain, that's necessary. That's the same concept of how to take care, or what we look for with zoster or shingles. Zoster or shingles is that infection that starts in a dermatome or in one nerve area. Well, if it happens to hit a rib nerve area, you'll see it because the rash will start back here, and you'll see it creep along right along this area, just following the nerve. It'll start as a red spot, then blister, then a red spot and blister, red spot and blister. This will scab over. You'll see this crop occurrence of zoster, but I digress. So the bottom line with ribs is, if you wanted to get x-rays, go for it. If you are older than 50, you probably should, because of the possibility of osteoporosis causing more than one fracture. If you have a complication where it's flailing or it's crunchy or you just can't get your breath, you have to get x-rays. If it's one hit and it's a bruise and it's mild, it's easy to tolerate, you might want to just wait for a while, take your anti-inflammatories or an anti-inflammatory herbal substitute, take pain control if you need it, try to stretch when you're ready, and then see how things go in 2 weeks. You always have to be up on your vitamin D3. I think it's important to supplement, at least for the short time of healing. Everybody needs vitamin D3, and I'll put a link to supplemental D3. And you also have to be on a mostly plant-based, I don't like dairy, but mostly plant-based whole food diet to give the body all the building blocks it needs to start healing up. Whether it's a fracture, whether it's a bruise, or whether it's just spasm on the outside, you need to give your body the best building blocks it needs to get better faster. And that's why I sometimes suggest not only medicines but supplements, not only supplements but alternative medicine like acupuncture, and, as I mentioned, even chiropractic to the point of a sublux rib. I've had this a couple times. Judo player gets thrown onto the mats, has pain, it radiates around to the front, ribs are not broken, the pain is right back here. I've had them sent to some chiropractors who will actually sublux the rib back in. All the pain goes away with one manipulation, so it is worth it to see.